Hi, my name is Stephanie Velasquez. For this video, we'll be showing you how to do a eye evaluation. All right, so my name is Stephanie Velasquez. Can I get your first and last name, please?
Brock Trim.
All right, and will you verify your date of birth for me?
3/1996.
Okay, so today I'm just going to be looking at your eye. I'm going to be touching your eye structures, shining some light into your eye. I'm going to get a good view of the back of your eye today. So first, I'm just going to touch your face. Is that all right with you?
Mm-hmm.
Okay, so before you do this, you need to make sure that your hands are clean, sterile, or with gloves. You have a lot of germs on your hands, and you can get those all into the eye, which is a direct form of or direct access to the bloodstream and can lead to infection with the conjunctiva. Okay, so first we're going to do the orbital margin. You just close your eyes for me. The orbital margin goes all the way around where we say the eye socket is. And then we have the frontal bone right here, the nasal bone, which is right here, that little bone in your nose, and the maxilla, and the zygomatic bones. Okay, and some of the terminology used with inspecting the eye involves the eyelid. So go ahead and close your eyes. This is the eyelid. You can pinch it. And then it also asks about the eyebrows. So the eyebrows are right here, and the eyelashes are right attached to the eyelid. Go ahead and open your eye. Some of the infections that involve the eye also talk about a lacrimal apparatus. And that's often where we get our tears from. So if you were to look inside the eye, I'm going to just look, perfect. Right in there, you see the lacrimal apparatus. Okay, so I am just going to go right in and start shining some light into your eye. So the light is going to pass through the cornea. The corneal lens will then change in order to allow light to come into his eye. So you should see when you shine a light into someone's eye that the pupil size will change. Okay, so in this video, you're looking for the acronym PEARL, which stands for Pupils Equal and Reactive to Light. So we can go from the outside in, just look straight ahead of you. Keep your eye focused on that. And you see the eye constrict. All right, same thing on this side. And same thing. So you should see that in both eyes. If you have significant deviation from that, you may want to consider some possible injuries that may be associated with the pupil dilation and constriction. Okay, now we're going to do eye tracking. So part of what you want to test with eye tracking is if you can see the lateral movements of my fingers while looking at a fixed position. So that is checking his peripheral vision. All right, so just go ahead and look right at me and let me know when you see my fingers. Do you see them moving?
Yeah.
Yes, okay. All right, and do you see it moving here?
Mm-hmm.
Don't look at it. Okay, ready? Do you see
yes.
it? Okay, perfect. Keep your eyes at me. Do you see it?
Yes.
Awesome. Okay, same thing. We're going to look at my finger. And it's going to go towards your nose. Keep your eye on it. Keep your eye on it. Perfect. Go ahead and relax your eyes. Okay, so when you're looking at the finger behind or in front of your face and you start pulling it away, you want to see that the eyes are following that and they're able to follow the finger distance. So they will go towards the eye and then away as you move it away from the patient. Okay, so now we're going to do the eye tracking itself. So we're going to do all the motions as they show in those chart that are like all the crosses. So the diagonal patterns of the eye. Okay, so now we're going to check the overall eye tracking. It's going to show, or it could be indicative of double vision, or even if they have any other stuff that might cause them to have eye tracking issues. I know some of them can, what is the name for it? Nystagmus? Yeah, so that repetitive movement. Okay, ready?
Mm-hmm.
Guys, just look at me. Fingers. All right, so just follow my finger. So we do lateral movements. And you also want to do vertical. And then you can also do the oblique to test the side acuity. Perfect. Okay. So, okay. Now we're going to do the retinal exam with the ophthalmoscope. So we're using the diagnostic Pico light. So it has just the, I don't know if you can see the number in there. You want to start at 0. And the black lights are for far objects, and the red numbers are for close objects. And when you shine the light into their eye, like we're doing so, you want to do it with the lights dimmed. For the purpose of this video, we're going to keep them on so you can see what we're doing. But if you can, when you do this, you want to have the lights dim. So when you turn on the light, you just shine it into their eye. You're going to be checking the red reflex. So if you have cataracts or retinal detraction, you will definitely see a change in this. So right now, it'll look like just you see that red come up. All right, one more time. If it were in a dim room, you would see it really brightly. You can't really see it when the light is on, so that kind of changes things. And I want to look at his optic disc now. You get a really good view. You got to get really close into the person. So what we're going to do is use the ophthalmoscope. I'm going to have the light on, and I am going to focus on an object that's near me. And turn it until you can see it just as clearly as you prefer. It will be different for everyone, so always start at 0. Okay, and then if we are examining the patient's right eye, we hold the ophthalmoscope with our right hand and we look in with our right eye. Also, you want to hold on to the patient's forehead and lift their eyelid so that you have the best access to view the optic disc. All right, I'm going to go ahead and look at the back of your eye. I'm going to shine this light into your eye, okay? Okay, and what you'll see is that orange circle. If you see blood vessels, follow that because it will take you to the optic disc. And when you're also doing that, if you have them look directly at the light, you can check, or it's referred to as a macular exam. All right. Okay, so now to check visual acuity, we can have them use the Snellen eye chart, this fancy little chart. So you want to have them stand 20 feet away, and you want them to read each line until they can not read the line clearly. So say they stop being able to read the lines at 9. 8 will be the last line that they can read correctly. So that each line has a number next to it, and it says 20 feet, and then 20, 20. So at 20 feet, this person would be able to read what normal people can see at 20 feet. And as it changes, you can say at 20 feet, you can read what normal people see at 100 feet. And that will just change. So for the purpose of this video, we're not going to do that just because we don't have the distance of 20 feet to record it, but we can have him pretend like we're going to do it. So we will have them occlude one eye first, and then we will do the other, and then we'll do both at the same time. So we want to check bilateral and then do both simultaneously to check the visual acuity. Okay, so we can just pretend to be 20 feet away and scoot back a bit. Okay. Just cover one eye. Perfect. And just read the last line, the smallest line that you can read.
PEZOLCFTD.
Perfect. And do the opposite eye.
PEZOLCFTD.
All right. And now you don't cover your eyes, and just go ahead and read the smallest line you can.
PEZOLCFTD.
Okay. So obviously he is able to read the bottom line. He is wearing contacts, and he has 20/20 vision because of that. So he is emmetropic. If he were to be able to see or be nearsighted, he would be myopic, and opposite, be farsighted, is hypermetropic. So if you do have a patient that wears glasses or contacts, you can check both, but we prefer that you do it with contacts or glasses in because that is how they'll be participating in sport activity. All right, that is all for my eye video.